I want to first say thank you to President Clark and also to members of council for this opportunity. My name is Jeff Garis, and I'm the Outreach and Engagement Director for the Pennsylvania Budget and Policy Center. The Budget and Policy Center fosters broadly shared prosperity, economic, racial, and gender equity, and environmental sustainability in Pennsylvania by means of nonpartisan research, policy analysis, public education and advocacy, and coalition building. Since January, Congress has been moving slowly to repeal the Affordable Care Act of 2010, sometimes referred to as Obamacare. That effort has been slowed by substantial opposition to this action, opposition that has been encouraged by a detailed look at the impact of repeal on the lives of Americans. There's much that is uncertain about the repeal effort. We do not know whether any repeal legislation will actually be enacted this year. We don't know which parts of the ACA Congress may keep and which it may repeal. We do not know whether Congress will enact some kind of replacement for the ACA, either at the same time as repeal or later. We do not know what that replacement could look like. In light of that uncertainty, what we as policy analysts can do is put forward our analysis of the costs of repeal based on our best guess of what repeal will look like. PBPC produced an analysis of the impact of repeal in Pennsylvania last month. Our analysis was based on the most recent repeal legislation that passed Congress but was vetoed by President Obama in 2016. Because there is almost total uncertainty about what a replacement would or could look like, we did not analyze any replacement, but simply looked at what happens if central parts of the ACA that enable people to secure insurance are repealed. What we found is simply horrifying. Repeal of two key parts of the ACA, the Medicaid expansion and the tax credit subsidies for insurance on the healthcare exchanges, would cause more than 1.1 million Pennsylvanians to lose the health insurance they receive through these programs. An additional 3,525 premature deaths will occur each year as a result. Our best estimate is that over 200,000 Philadelphians will lose health insurance as a result of repeal of the ACA. About 2/3 of them will lose their health insurance as soon as the repeal of Medicaid expansion takes effect, with the remainder becoming uninsured by the end of the second year after repeal. An additional 778 people will die prematurely each year in Philadelphia. Most of those who lose insurance will be people who have recently secured it through either expanded Medicaid or through receiving tax credits to purchase health insurance on the new health exchanges or marketplaces. However, the kinds of repeal contemplated by Congress will likely throw the entire individual health insurance market into chaos. Among the over 200,000 Philadelphians who will lose their insurance will be some who have purchased health insurance in the individual marketplace for years and without any subsidy. We estimate that over 10,000 of those people will find their current health insurance unaffordable due to the effects of the ACA repeal. Hospitals statewide will see their revenues decline by almost $1.6 billion annually. Doctors will see a drop of $500 million in yearly revenue. Some hospitals and physicians' practices, especially in urban centers and rural areas, may not survive. Philadelphia hospitals bring in about 25% of all hospital revenues statewide. Between 2013 and 2015, the revenues of Philadelphia hospitals increased by $900 million. If their loss of revenues due to ACA repeal is proportionate to loss of revenues statewide, they will lose $400 million annually. But Philadelphia hospitals may suffer more because they care for many patients with low incomes. Under the ACA, the rate of uncompensated care provided by Philadelphia hospitals declined from 2.8% in 2013 to 2.4% in 2015. Repeal of the ACA will cost over 50,000 Pennsylvanians their jobs, reduce the state's gross domestic product by over $30 billion, and cut state and local tax revenues by $1 billion over 5 years. We at PBPC have only a limited capacity to make projections about the impact of ACA repeal on the economy and tax revenues in Philadelphia. We can only estimate the proportional impact of ACA repeal on the city based on its share of the state's population and total state and local tax revenues. On that basis, we believe that repeal of the ACA will cost Philadelphia in the neighborhood of 5,000 jobs and $50 million in tax revenues over 5 years. Repeal of the ACA will add over $1.4 billion to the state's structural deficit. Unless taxes are increased to cover that debt, the result will be reduction in state expenditures, mainly in the areas of education and human services. Philadelphia will suffer greatly in any general reduction in such spending. We do not make any projections based on any replacement of the ACA by another proposal because we know little or nothing about what such a proposal would look like. That's my testimony. Thank you.
Thank you. Puts it in stark terms, does it not?
That's why we entitled it Devastation, Death, and Deficits as the name of the report.
Okay.